This is Irving Stackpole, and I'm very pleased to be with you at the CIHT conference, the Crikvenica International Health Tourism Conference. I want to thank Alfred and Vladimir for inviting me here again. And today, in this presentation, I want to talk with you about health tourism unlocking the lockdown. There's quite a lot going on. We are all experiencing this together for the first time, including developing conferences remotely and individually. So I hope that this goes without hitch and that there's value to be derived from it for you. As you may know, I've been the principal of Stackpole Associates since 1991. We've worked all over the world. With my colleague Elizabeth Ziemba, we published the first book on medical tourism marketing, and with another colleague this year, Laszlo Puszko, we hope to publish another version, another updated marketing handbook for health tourism very shortly, and the information about that is on the screen. So for this particular presentation, what I'd like to cover are the factors impacting health tourism, medical tourism, specifically related to the pandemic. And there are external factors, there are demand factors, and in that is included travel and the psychology and behavioral science associated with the pandemic. There's the supply and capacity issues associated with the pandemic, and where I believe and how I believe the path to recovery will begin to appear. The first thing, of course, is to understand that health tourism is not a monolith. It's not an industry. It's not a sector. It's a set of highly fragmented, regionalized markets for specific types of services. And these services array along a range of acuity or complexity, and there's a direct relationship between the complexity and the frequency, and it looks something like this, where on the high volume, low unit value side of this market are dental and low impact cosmetic procedures. Also on this side would be spa treatments, balneotherapy treatments, and other wellness and health-related treatments, what my colleague Laszlo likes to refer to as hedonistic treatments. On the other side of this vertical red line are low volume, high unit value procedures, orthopedic procedures, cardiac procedures, vascular procedures, and many forms of cancer treatments. Also bariatric procedures. So these are low volume, high unit value types of procedures for which health tourists travel. And this relationship between high volume, low unit value and low volume, high unit value comes to bear on how we believe the markets for health tourism will recover, which I'll cover at the end of the presentation. The market factors, which are now and have been since the beginning of these markets, the beginning of the emergence of these markets in the very early 2000s, is the destination stability, the perception of destination stability among the consumers. Access, how easy is it to get to the destination? The economics, are the economics of the destination location good for the source location consumers? It's certainly far less expensive for me when I'm in the United States to travel to Mexico for care. On the other hand, for Mexicans traveling to the United States, there's quite a hill to climb because care in the United States is so much more expensive. So that's what we mean by inflation, recession, and purchase power parity between the countries. The next factor is capacity. Is there capacity for the targeted service in the destination location? and certainly in the category of health tourism in these markets, providers around the world have been building capacity. Kavarna Health is all about building capacity in the Kavarna region for the providers that participate in that cluster, in that marketing group. Bagatang Clinic is another example, and there are many others as well. And the final factor is, of course, the reputation and the brand of both the destination and the providers. And these interact with each other in a way that I'm sure you can appreciate. We'll discuss a little further. So this is an historical comparison of travel. This is taken from Flight Radar 24, which records all of the air trips around the world. And this is a 7-day moving average of commercial flights between 2019, which is the green bar at the top, and January 1 to March 2020 in the blue bar at the bottom. And as you can see, the number of commercial flights fell off precipitously. There's a dramatic change, and we've all noticed this. This is nothing new. What we have seen is we have seen a bit of a recovery in the commercial flights, as you can see in this upswoop in the tracking line for the 7-day moving average of the number of flights. This recovery is very slow and very gradual. And as you will see from other data, these travel recovery, which is of course central to the recovery of health tourism, is also manifest in other economic recovery data that we look at. And here we see the recovery data in GDP for several European countries. And the recovery, you'll notice the pattern here isn't a U shape or a V shape, but rather is more like a Nike swoosh. And that's how the recovery from the effects of the pandemic will be manifested, how it will be seen throughout the world, in part because of the lack of coordination of the effects of the pandemic and the response, the public health response by countries, by nations, even by regions to the public health crisis, the pandemic. In addition, the capacity is an important feature of the attractiveness of a destination location for health tourists. Why would a health tourist go to a particular destination if the clinics, the hospitals, and the providers weren't able to serve that consumer and weren't able to demonstrate capacity and demonstrate ability? Well, in the case of COVID, there's been a real impact on capacity in many locations around the world. And now, unfortunately, after having gone through the first wave of the pandemic, we're now going through a second wave, which has a double whammy effect, a double effect on not only travel, but the confidence that consumers have. One of the reasons for this asymmetry in the response to the of consumers to the crisis has to do with confidence. And some percentage of the business that had been health tourism for hospitals will simply not come back. And being able to gauge what that is and in which markets will be central to our ability to plan for and effectively leverage the recovery. So one of the factors that is occurring around the world, it was written about in The Economist in May, is pent-up demand. Certainly providers in certain locations, as they begin to open up, are experiencing a surge in demand. It's very difficult to get surgical suites booked for elective procedures, for example. And that's because of the phenomenon of pent-up demand. Just because travel locked down and because hospitals weren't accepting elective procedures during the worst of the pandemic, it doesn't mean that individuals didn't continue to need or want certain types of procedures. So there will be pent-up demand that can be taken advantage of immediately following recovery. So what are the keys? What are the keys to unlocking this lockdown? Well, the first is to look at new markets. And these would be individuals who are looking for services, looking for other service lines that perhaps your destination hasn't been known for, or perhaps you as a provider have not historically provided. So there's not only new markets, but new source marketplaces. And one of those new source marketplaces might be right next door. Instead of going across the region or across international boundaries, it will probably be very important in the recovery effort to go closer to home, to look closer to home for consumers who need or want the services you provide. Another set of tactical observations have to do with consumers' fear. And I think this is tremendously important. There was always a certain level of uncertainty and risk associated with traveling for healthcare, and that fear or concern, that uncertainty and that risk is redoubled. It's doubly increased in this time. So one of the things that we'll need to do as providers and as destinations is to demonstrate and show safety, which historically was not a very good thing to do from a marketing point of view. There's lots of research to show that safety isn't the kind of quality or feature that providers should be promoting. But indeed, in this environment, that's exactly what's necessary. And what the pandemic has shown us is that the health tourism journey will be changed, that consumers in the classic model typically go from what's known, go through trust and uncertainty to go to the unknown. And in health tourism, that was certainly true. That psychological or emotional journey has been impacted by the pandemic, and we as providers and as destination managers need to be aware of this and attend to it. Well, how do we do that? Well, certainly, if you clean it, will they come? A takeoff on the movie, if you build it, will they come? And we need to show or demonstrate that our facilities, our centers, our hospitals, our clinics are clean, that we've attended to the basics and even gone beyond cleaning and introducing standards and symbols. All of these logos are proxies, are symbols that show that we as providers, we as hospitals, clinics, and destinations are attending to the important feature of sanitization and cleanliness in our centers. This will help reassure consumers and to bridge that uncertainty. In addition, a critical element is testing. And I have a video, I hope it plays here, to show even SpongeBob SquarePants gets the importance of testing. So testing is a central part of what's needed to move beyond the uncertainty and to transform the needed customer uncertainty to customer certainty. And there's SpongeBob again. So what does health tourism, medical tourism, the recovery look like? As I said at the beginning, health tourism isn't one market or a monolithic block. It's a set of vertical regional markets. And the way these markets work, we can predict what the sequence will be in recovery. And in fact, early evidence suggests it bears this out. The first segment that will come back will be the vanity, or what my colleague refers to as the hedonistic market. These are low-end cosmetic and dental procedures, even somewhat more complex cosmetic surgery. So look for hair transplantation, dental veneers, orthodonture. Look for these cosmetic procedures to come back first. These consumers will also be far more risk tolerant. So these segments, these verticals will come back first. The second group that will come back at about the same time are the high acuity, the high risk consumers, because for many, it's the treatments that they're seeking are seen as life-saving, life-sustaining, life-extending. So there's really little option, perhaps, that they will have. So these two ends of this market distribution will return first. The middle will come back last. So here's the way we see this emerging. First, the market will unlock locally before it unlocks at distance. So look at source markets that are local. The first segments that will unlock in the markets will be the vanity and hedonistic segments. The second, very high acuity, life extending, critical procedures. The third will be the middle market. And unfortunately, historically, that's been the most profitable segment of this market, but that will actually recover last. The tentative attitude of consumers, their hesitation, needs to be central in our concern for how we manage this recovery. The remote solutions such as telehealth added to additional customer care, customer service, and management of leads will be very important for all providers. And the issue of fear versus risk tolerance will come center stage, and we'll need to do a far better job of segmenting our markets and understanding psychographically who's willing to travel and who isn't. So with that, I will say thank you very much. I hope this has been time well spent. I'll look forward to participating with you virtually and look forward to your questions as well. Here's my contact details. And once again, I want to thank the Crikvenica Healthcare and particularly Alfred and Vladimir for inviting me here for this presentation. Hvala, thank you.